right. So yeah, our topic is menopause. I guess I should go back and do that. Our topic's menopause for this. This is like one of the hot topic virtual shadowing events. And I think this is just a great topic to include there. You know, it affects half the population, something that many people go through, and it's something that's not always talked about a lot. So I think it's a great thing to learn about since, you know, if you guys are going into healthcare, that's something that a lot of your patients will go through at some point. So yeah, great thing to know about. And then just a little bit about me for people who haven't come to one of these with me before. My name's Kate. I went to Clemson University and I did my bachelor's degree in chemical engineering, and I stayed and did a master's degree at Clemson in applied health research. So kind of like it was very similar to like public health kind of classes. Yeah, so that's kind of what I did for those years. And then I go to medical school at NYU Grossman School of Medicine. I'm currently an MS2. And so in our second year, we do clinicals our second year. So I'm currently on my surgery clerkship, which has very long hours. So I think I got off today. I think I worked well, I say worked, like I get paid, but I think I was there like 6 a.m. to 6 p.m. today. So I'll be going to bed after this. But I love it though. It's great. Clinicals are the best. And then yeah, I've worked with Motivate MD, I guess for like a year now, and I do interview coaching, occasional advising, and then I do a ton of editing too. So that's a little bit about what I do. And I like to include some pictures. I have a cat that I got while in med school, so I include a little picture of her. And then you still have time for a bunch of the hobbies in med school, so don't let that freak you out. I do rock climbing. I play soccer every single week. Played soccer for like 2.5 hours yesterday. So you can still have your hobbies. And I also, big plug for anyone interested in surgery, I used to love making friendship bracelets all the time, and it has helped me so much on my surgery clerkship, for like tying knots in surgery and all that stuff. So hobbies can help you out for sure. And we'll do a little poll. I always like to do these. Let me do my poll. If everyone wants to fill this out, let me find it. Can't find my poll. 1 second. Well, I can't find my poll, so what I'm gonna have you guys do is my poll was basically gonna be tell me, since there's only like 4 of us, just tell me in the chat, which is your favorite season, spring, summer, fall, or winter, or if you're in a place where you live, or if you live in a place where there's no seasons and it's just like hot or cold all the time, you can tell me that too. And then I just want to know how much familiarity you have with like the topic of menopause. Like, do you know a little bit? Do you know nothing? Do you know a lot? Yeah. Just tell me in the chat since I have no idea where my poll. I just made one. Okay, so we have know most about menopause, favorite season is summer, fall, and then fall from Logan, zero familiarity, quite familiar from someone, spring, and then I know a bit. Great. So we have a kind of a little bit of variability, which is great. So feel free to, you know, chime in if you have any questions, especially if you know a lot about the topic. I'm not gonna act like I'm an expert on the topic, but I'm happy to like try to look things up for you, if I don't know the answer, or yeah, or to have a discussion about it. And my favorite is definitely fall, which I'm very excited to be entering fall soon. I like the vibes, I'll say. I feel like it has the best vibes of all the seasons. So I think that's my favorite. But it looks like we have a lot of different opinions. So I will say spring's my least favorite because I have allergies. Oh yeah, and then let me go back. You can scan this for I guess there's a form. Oh yeah, I still made a little quiz thing for this. So scan this to fill out the little quiz for participation. And if you have any questions on the quiz, sometimes I make the quiz and then I adjust some things in my PowerPoint. And if for some reason I didn't cover something that I put on the quiz, just ask me during, like, if you're filling it out during this, you can just ask me at the end. All right, so let's get started. And again, I'll have the chat the whole time. So while I'm talking, just feel free to like chime in, ask any questions, anything like that. So menopause, for those who do know or don't know, is a significant phase in a woman's life. It's marked by the end of menstrual cycles. And it's also marked by a reduction in reproductive hormones. And specifically, I think the actual definition, like the clinical diagnosis, is like 12 months without a menstrual cycle, is like the cutoff when it's considered menopause. And it typically occurs between the ages of 45 and 55, but this can vary. I think the average is 51. And then, so there's a bunch of different hormonal changes that happen during this time. So first off, estrogen declines. So estrogen is a key hormone produced mainly by, does anyone know what produces estrogen? Estrogen? What organ? You can just type in the chat if you know what organ produces estrogen.
Ovaries.
Yeah. So it's a key hormone produced mainly by the ovaries. And during menopause, the ovaries gradually produce less and less estrogen. And this drives a lot of those menopausal symptoms that you hear about, such as, hot flashes, night sweats, vaginal dryness. And there's also this lower estrogen can also affect bone density, leading to less bone density and osteoporosis. So that's something we always watch out for with people going through menopause. And then progesterone also goes down. So this is another important hormone that's produced by the ovaries. And it's a hormone that helps, regulate the menstrual cycle. It supports pregnancy, stuff like that. And as menopause approaches, progesterone levels drop significantly, just like with estrogen. And this reduction contributes to the changes in the menstrual cycle and eventually to its complete cessation with menopause. And then there's two hormones called follicle stimulating hormone, or FSH, and then luteinizing hormone, or LH. This is kind of a hard question, so you can just tell me if you don't know, but does anyone know what, I'm not going to say organ, but what thing in the body creates these hormones? If anyone knows anything about kind of how our endocrine system works, that might help. And you can just tell me if you don't know. Hypothalamus is a great guess. It's not the hypothalamus, but it is related to the hypothalamus. But that's not actually where these are produced. Any other guesses? Pituitary. Yeah. It's the pituitary. So the hypothalamus is a great guess though, because the hypothalamus and the pituitary are like both very related on the endocrine axis. Like the hypothalamus makes one hormone that then gets sent to the pituitary, which makes another hormone. So very related. But yeah, so follicle stimulating hormone and luteinizing hormone are specifically made in the pituitary. I think follicle stimulating hormone stimulates the ovaries to produce eggs and estrogen. And so actually, when our ovarian function is declining and our estrogen levels are dropping in menopause, the pituitary gland will actually release more and more FSH and LH as an attempt to like stimulate the ovaries, kind of because they have this negative feedback loop. So like because there's less estrogen, it's going to try to increase FSH and LH. And basically, like that's not going to do anything. The estrogen is going to go down no matter what. But it's a great way for us to, it's something that we can test to like get a sense of what may be going on. Of like, oh, do we think someone might be entering menopause? We can test these hormones, and if they're elevated, that's a pretty good sign. So yeah. And then another thing that's affected is I think testosterone. I believe testosterone also goes down. Oh, and I have it here on my slide. The GnRH that you see on the slide, that is that's what's made by the hypothalamus. All right. Anyway, so testosterone levels. So although testosterone is often associated with men, it is also present in women. It plays a role in, actually ask you guys, what do you think testosterone plays a role in women? Like what kind of things do you think testosterone affects? Muscle mass is close. I think, yeah, yes, testosterone and other androgens, like DHEA and stuff, affect muscle mass, but yeah, I agree. And then also things like energy, mood, libido, like sex drive, all of those things are influenced by testosterone. And so testosterone decreases in menopause along with all of the other hormones because testosterone, I believe, is also actually made in our ovaries, in women. And so as all these things go down, um, you'll also see like you'll hear people going through menopause complaining of lower sex drive, lower like lots of fatigue, so low energy, things like that. And that's related to these changes in these hormones. And then I also think it can affect cortisol, like our stress hormone, maybe making people going through menopause like have trouble sleeping, feel more stressed, that can also contribute to hot flashes, things like that. Um, and then can also affect you'll see thyroid hormones, I can't talk, get affected as well during this time. So yeah, there's a bunch of different changes that happen during this time. And I also wanted to highlight just differences in like when menopause or when this lack of menstrual cycles happens, there's different like terms for that based on the time that it's happening. So you have premature ovarian insufficiency or premature menopause, and that happens when it's before the age of 40. So that's when someone has lost their menstrual cycle before the age of 40. And so this can be due to like genetic conditions like Turner syndrome or autoimmune disorders where like maybe the body's immune system is like mistakenly attacking ovarian tissue. Also things like chemo radiation or surgical removal of the ovaries. Things like that can kind of put your body into premature menopause, basically. And you'll hear lots of times, I think actually the symptoms can be a bit worse in this case because like people are younger, and then also it's like generally tending to come on with a lot of these things that you're going through all these changes much faster. Like with a surgery, it's like happening overnight. And then also people see a lot more people with this concerned about the fact that it impacts their fertility. Sorry, one second. I'm getting chats. Let me turn this off. One sec. Okay. Let me play this again. Okay. And then you can also have early menopause, which is between 40 and 45, and then menopause, which is after 45. So those are kind of, and some things that can relate to early menopause can be things like family history, like if this happened in your mother, your mother's mother, things like that, some autoimmune conditions as well, again, like chemotherapy, things like that. And then kind of going back to the hormonal changes through our body, we like through a woman's body like during time as well. I just kind of included these graphs. I don't think I'm going to spend too much time on these, but I just thought these would be helpful to kind of see how these hormones in women's bodies are kind of changing over time. So you see like estrogen and progesterone are going down and they start off much higher. And then testosterone as well kind of starts off lower and then you see that decrease as well. Other things going on, melatonin, and those FSH and LH levels. So yeah, just to kind of put into perspective some of the stuff I've been talking about. And yeah, and you also see that they kind of peak in like, I guess the teenage years. I guess you can't really see that though. All right. So why focus on menopause? So, I mean, we first off, we have an aging population. The global population of women over 50 is growing, and so there's going to be a higher number of women experiencing menopause. And then this demographic shift highlights the need for increased attention to menopause-related health issues. And then as the number of women experiencing menopause increases, so does the prevalence of associated health issues, making it a critical area for healthcare focus. And that also is impacting so many people's quality of life. So menopause symptoms like hot flashes can significantly disrupt daily activities and impact your overall well-being. I don't know if any of you have ever experienced like the feeling of a hot flash. Like it can be very distracting when you're trying to do other things for sure. And then the symptoms can affect, sleep, work, performance, social interactions, all those things. And then there's also, healthcare costs related to this too, both direct healthcare costs and indirect costs like low productivity for people going through these things. So managing these things can be really important from a cost standpoint as well. And then there's also emerging research in this field, so it's great to be talking about this and talk about, the new treatments that are coming out. So I just wanted to touch on now, just like how menopause really does impact these different areas of our health. So I think the first I wanted to talk about was bone health. So something we monitor in women going through menopause is we monitor we do bone scans and things like that to monitor if they're at risk or developing osteoporosis. Because there's a very significantly increased risk when someone's going through menopause, because the decreased in these like estrogen is protective over kind of your bone health, and as the estrogen levels decrease, you can see accelerated bone loss, basically, leading to these fragile bones, which is what osteoporosis is. And you can also see a higher fracture risk with greater susceptibility to fractures, especially in the spine, hips, and wrists. And then you can see as well like bone pain and discomfort because of this. And also like changes in the bone remodeling as well, where like the bone's being resorbed and then forming again and resorbed, and it can cause these like different like masses and things and pain. Just because these hormone changes are impacting our like the normal bone remodeling process, basically. And before I go to the next slide, does anyone have any ideas of possible ways to like manage these symptoms for people, like whether it's medicine or lifestyle changes, or how do you think we can manage these in these people? Exercising, that's a great idea. Yeah, especially like strength training. I think there was a whole like I think in the older generation, especially, I think a lot of women didn't really strength train. It was more like, dieting culture and things like that, especially, in previous years. And so you see a lot of women really struggling with this bone loss and menopause because they didn't like kind of do that strength training in those years where it was really, really important, kind of as a preventative measure from this stuff. So I think strength training, especially for women, is really important for things like this. And someone said calcium supplements, that's a great idea. So yeah, calcium and vitamin D. Vitamin D is kind of part of helping your body make calcium. It's in that process. Um, so doing both of those supplements is really important, and you'll see a lot of women going through menopause taking these supplements. And yeah, exercising, like someone said, weight bearing exercise specifically, strength training, things like that. And then we do regular DXA scans, which are just bone density scans to assess for like osteoporosis and fracture risk. And it gives them like, I think, a fracture risk score, basically, to kind of monitor their risk, basically, for that. And then I think every 1 to 2 years we do that. And then you can also, there's some medications that help as well. I'll kind of talk specifically a little bit about hormone therapy later. But there's specific medications that can help with this as well to prevent bone loss. And then just general things like avoiding smoking, limiting alcohol consumption, things like that, ensuring a balanced diet. Yeah. All right. And also another really big thing that we worry about with menopause is its effects on cardiovascular health as well. because estrogen is also preventative against heart disease. This has been like very well proven in the literature. And so there's a higher likelihood of developing coronary artery disease and other cardiovascular conditions when estrogen declines. And so again, with all these things, this is something that we're really worried about, especially when people go through like they have like the premature ovarian insufficiency and are going through menopause earlier, basically, because that's a longer number, a higher number of years that they're like exposed to this low estrogen state, which puts them more at risk for these things. And you'll also see like increases in LDL or the bad cholesterol, because these hormone changes also affect like lipid metabolism. It affects like our insulin resistance. It can lead to obesity, can lead to hypertension because of the possible weight gain associated with that. And also because of the possible weight gain, you can get an accumulation of abdominal fat. And again, that leads to insulin resistance and things like that. So these all just kind of cycle because estrogen is protective for so many of these things. So again, I'm going to do the thing where does anyone want to suggest any preventative measures for these things? Exercising. Yep. Anybody else? All right. Go ahead to the next one. Yeah, reducing salt intake. So yeah, like a healthy diet again, reducing salt intake, things like that. I don't actually, I'm gonna with the salt intake, I'm gonna maybe disagree with that, but we can have a different conversation about that. Reducing salt intake is only helpful for people who actively have heart failure just to decrease the amount of like swelling that they're having, like the edema. But otherwise, a lot of salt in your diet has actually not really been shown to be like a risk factor for these things. So actually, like if you're a person that puts salt on everything, it's kind of okay. So yeah. Anyway, side note. But yeah, regular physical activity. Again, monitoring is so important for all these things. Just like we monitor bones, we also want to monitor blood pressure, cholesterol, and then also there's medications as well. Statins are fantastic medications. I will be on a statin as soon as I turn 30 because I have high cholesterol. But statins are like they decrease mortality. I think it's morbidity or mortality or whatever, like so significantly from heart disease, like in prevention. It's awesome. They're great medicines. And then also like antihypertensives, just maintaining the cholesterol and the hypertension, basically. Yeah. Mental health, this is also a really important thing to talk about with menopause, is you can get like mood swings. People a lot of times talk about with these rapid kind of intense mood changes as your hormones are changing pretty rapidly. You can go from being really, really irritable 1 second to really, really sad another second. And that can be again really harmful for productivity, for trying to relax, anything like that, trying to sleep. And then also depression and anxiety are people going through menopause are at increased risk for these things, on top of people who are also elderly are also at risk for these things. And that's just also exacerbated by going through menopause too. So it's definitely a very tough time for people. And something important to keep in mind. And also a big thing that you hear about is people have trouble with like their memory and their concentration, as well as like being tired. They also have trouble concentrating because of like messing with their sleep and hormone fluctuations and mood changes. So yeah, this can impact a lot of different things. And then for management, again, we talked about exercise and stress management, and there's also, therapies like CBT, talk therapy, things like that. And then again, I'm going to talk about hormone replacement therapy, but it really is kind of the best solution right now to a lot of these things. And then as well, like sexual health as well. We talked about the testosterone going down, which can decrease libido, and then vaginal dryness can be really, really bothersome to people going through this. Sometimes lubricants help. Sometimes you can also do some vaginal estrogen, basically, to help with this. But yeah, this could cause people a lot of pain during intercourse. And then changes in orgasm as well, or again, like low sex drive. And then also pelvic floor weakness. People who have given birth also have trouble with pelvic floor weakness, and then menopause can also exacerbate that. So this is like your pelvic floor kind of holds these things like your bladder and stuff like that. And so like you'll have like incontinence where like you cough and you pee yourself and things like that that can be really bothersome for people. Yeah, and I kind of talked about, yeah, so you can do lubricants and moisturizers. You can do like vaginal estrogen to help with this, as well as like systemic hormone replacement therapy. There's also pelvic floor exercises. If anyone has ever heard of Kegels, like those are very, very good exercises to help people strengthen their pelvic floor during these times. They're not having this like urinary incontinence. And then sexual counseling during this time can also be really, really helpful for people since it is something that's not always talked about and how this affects like people's sexual relationships. So that can be great as well. And just like open dialogue that these things are going to happen with your patients is really important. So, I mean, the gold standard for treating this is hormone replacement therapy. And I want to kind of talk about this because right now it's the best way to kind of reduce the morbidity of all of these kind of other things that can happen with menopause. And then it's like if anyone knows the birth control pill, that's also like a hormone replacement therapy, and people know some of the risks with that, like blood clots and things like that. Something important to note with this kind of hormone replacement therapy is that it is a significantly smaller like amount of estrogen compared to hormonal birth control. So you only really see the risk of like blood clots and things like that with people who are already like at pretty high risk for because of other comorbidities. So there's like a risk scale that you can do for this when deciding whether or not to put someone on this on hormone replacement therapy. But I mean, it is basically you're replacing this estrogen, which the lack of has been causing all of these other problems. And so obviously it's going to help with all those problems. I also want to note, I think I'm going to talk about it a bit later, but I want to note here, I don't know if anyone heard about this study that came out, that was basically a very large study, basically saying that of people who were on hormone replacement therapy, there might be a possible risk of breast cancer. So there's only been there's like one large study I saw with this finding. So that's just something important to note as well. Is that they saw in the large general population of people taking this that there might be an increased risk of breast cancer. And then also we know the risk of blood clots and stroke and things like that with this as well. So important things to consider, especially in people who have a history and things like that. But I will say the research on the breast cancer topic, I'll talk about this later, is kind of confusing, I'll say. Okay, and then other treatments if people don't want to do hormonal therapy, you can also do non-hormonal medications. Yeah, like clonidine is used for like hot flashes, gabapentin is used for hot flashes. None of them are as effective as hormone replacement therapy. But I mean, you do what you can. And then also diet, exercise, stress management, all of those things can help as well, like we talked about. And then how are treatment decisions made for these kind of things? I mean, when you're kind of making a plan with your patients, you want to consider their history, like previous hormone therapy use and how it went, family history of hormone sensitive cancers, like breast cancer, things like that, anything you might want to take into consideration. And you also want to think about patient preferences. So discussing benefits and risks of each treatment option, aligning treatment choices with patient preferences and lifestyle considerations, and then risk assessment as well, like I was talking about, especially if you're putting someone on hormone replacement therapy who also is at risk for stroke, maybe consider the risks and whether the benefits outweigh the risks for that. And then just regular follow-up, making sure that, you know, these treatments are actually helping people and following up regularly and stuff like that. I'm not gonna spend too much time on this, but I just wanted to note some of the like upcoming research in menopause. The stuff that I find the most interesting is bioidentical hormones. So hormones chemically identical to those that the human body produces, but can potentially be kind of engineered to be safer. Is kind of what I'm most interested in that's coming out. Because I mean, if you could have the hormone replacement therapy and all the benefits without all the risks, I mean, that's kind of perfect. And also like I think people sometimes use transdermal patches, and I think those like vaginal rings are already kind of out and being used occasionally. And then also like screening through genetic research for stuff like that and being able to like, do personalized medicine, specifically tailor it to someone's specific genetics and how that's going to influence their kind of menopause course and stuff like that. And then also like mindfulness meditation, things like that. And then there's also like I saw something about these plant-based compounds that kind of mimic estrogen and aren't hormonal. So that's kind of interesting. But yeah, basically anything that can mimic estrogen without all of the risks is like would be perfect. So, and I just wanted to also kind of touch on surgical menopause specifically. So does anyone know why someone might have their ovaries removed before menopause? So, but why? Okay, I'll challenge you then. Why would someone have a hysterectomy? Other people feel free to chime in too if you want to like interact. Ovarian cancer. Yep, exactly. That's why someone would have their ovaries out. Yep, exactly. Um, Hysterectomy you can also see in people who have like kind of really significant uterine fibroids. You'll also lots of times see them get a hysterectomy. But actually a hysterectomy is not really going to put you in menopause because you're taking out the uterus sometimes and not the ovaries. So if you're not taking out the ovaries, you're not going into kind of menopause. Sorry, internet briefly kicked me out. Let's try this again. All right. Okay. Um, but yeah. Other reasons that you could have this would be like other reasons that you could have surgical menopause or get like a surgery specifically. Would be like, has anyone heard of a BRCA mutation, which puts you at high risk of things like ovarian cancer and breast cancer? If anyone's heard of that, that's a reason. And then also ectopic pregnancy can also be a reason where you get like the the kind of the tubes as well as the ovaries out, basically. That can be like a kind of a severe consequence of that. But yeah. And then so yeah, like I mentioned before, you get that abrupt hormonal drop, and then you also get like those more severe hot flashes and things like that because of that. and like accelerated bone density loss and stuff like that as well. So can we have some pretty significant effects. And before I go to this, so does anyone have any kind of thoughts on how we should manage maybe someone who has survived breast cancer, who is going through maybe really severe menopause or surgical menopause? Any thoughts on like how we should manage that? Like, should we give them hormone replacement therapy? Or how should we kind of manage their symptoms? Have any ideas? No hormonal therapy. Yeah, and I will say with hormonal therapy, I'll show my slide now. There has been like some mixed results basically on the larger scale of does it put you at breast cancer risk at all in the general population, and then also like there's been a lot of studies looking at like BRCA carriers as well as people who have previously had breast cancer and if they are actually at higher risk of recurrence with hormone therapy. And I will say I'm not super convinced by the research that it actually puts you at significantly higher risk. But yeah, so I just kind of listed, it's definitely interesting. You can always ask me later if you have more questions about this, but I kind of went on a deep dive of this recently, for like a kind of school project. But yeah, so that's kind of interesting. So you see a lot of times with these big kind of mass studies of like, oh, this thing puts you at risk for this thing. And a lot of times those kind of very large studies, aren't always super convincing, especially when they're covering such a large portion of the population. You're also just kind of seeing things that are just generally maybe present in a large portion of the population anyway. So yeah. Okay, so with the rest of the time that we have, this is where I would love you guys to participate since the rest of this kind of time is meant for you guys to participate. So I want you to imagine that you're seeing a 52-year-old patient who's experiencing severe hot flashes, night sweats, sleep disturbances, has a history of hypertension, but otherwise is in good health and is considering hormone replacement therapy, but has questions about its safety and long-term effects. What initial questions might you ask? And then are there any tests or evaluations you would want to order? So when I'm thinking through what initial questions I might want to ask, I would maybe want to ask, how long have you been experiencing these symptoms? Yeah, when was their last period is great. How long have these symptoms been happening? How are they impacting your daily life? Is always a question you want to ask with so many different things. Also, like, do you have any history of hormone sensitive cancers, cardiovascular diseases? Do you have a family history of osteoporosis, breast cancer, things like that? What medications are you currently taking? Exactly. What's your diet like? Do you exercise regularly? How do you manage stress? All those things. And then the tests and evaluations to order, like we had talked about, is that DEXA bone density scan, and then also a lipid profile to assess part of their cardiovascular risk, blood pressure measurement in office, Mammogram is a great one to screen for breast cancer. And then also just like general labs and stuff like that. And then over time, you just want to be doing regular follow-up appointments, be monitoring their bone density over time, and then also their cardiovascular health over time. We'll go to the next one. So in this case, you are evaluating a 54-year-old patient named Sarah with a variety of symptoms, hot flashes, night sweats, mood swings, also reported joint pain and recent weight gain. Her medical history includes type 2 diabetes and a family history of breast cancer, and she is currently on medication for hypertension and diabetes. She's worried about the potential risks of hormone replacement therapy and seeks alternative management strategies. What additional information should you gather and any tests, and how would you manage this if she doesn't want to take hormone replacement therapy? So stuff I might ask, okay, how long has she been diabetic? That's great. Also, like, again, onset and severity of the symptoms, how they impact daily life. A great thing to ask with diabetes as well is how well is the diabetes controlled? Like, what was your most recent hemoglobin A1C? Any recent changes in your blood glucose levels? What is your blood glucose level normally at if you monitor it? Stuff like that. Someone said if she's concerned about HRT, then a non-hormonal medication like gabapentin, exactly. You can do also SSRIs or SNRIs for mood swings, depression, anxiety, things like that. You can also do emphasize those lifestyle interventions as well. And then again, you also just want to be doing all of those screenings as normal. And again, you would also want to order a hemoglobin A1C to be monitoring that as well in diabetes. And you also want to explore this joint pain as well, the nature of the joint pain, what's its onset, what's its location, how severe is it, and has she been evaluated for this pain before? Because you want to kind of rule out, is this like an osteoarthritis or rheumatoid arthritis? Like what's going on with this as well? And also family history, again, like we talked about, and then review her medication list and stuff like that. All right. Last one. So 48-year-old woman with BRCA mutation underwent BSO 3 years ago, experiencing significant menopausal symptoms of hot flashes, joint pain, and mood swings. How would you evaluate her suitability for HRT? How would you balance that with cancer risk? And we already kind of talked about alternative treatments. But yeah, how would you kind of evaluate the benefits and risks of this? So I think what I would do, it can do hormonal therapy, exactly. I think I would also, if I was the provider, would again want to really like consider the current research on the topic and then be able to like explain the state of that research to your patient. That's really important of like this is like the kind of things the research did well maybe and the things that maybe it was lacking. And these are the findings. Kind of present like give them a quantitative amount of risk if you can, and then leave the decision up to them, of like, oh, in this study out of this many people, the percentage was this. These are some kind of flaws in the study, giving them that knowledge, and then kind of letting them consider as well what is in their best interest and how like kind of making that decision together, I think is really important. And with this, I mean, you would also along these lines also want to consider other risks, like other like kind of risk factors for complications with HRT as well. You want to assess like the risk of like clotting and things like that as well, or any other contraindications for having hormonal therapy. Yeah, and you can also do those non-hormonal medications that we talked about. But yeah, I think with this topic, it's really that you want to be able to have with any topic like this to be able to understand the current research on it and be able to present it to people in a way where they can make their own decisions. You know what I mean? So I think that's true regardless of the specialty.